Hi, I'm Donna Russo.
Hi, I'm Aldine Morris,
We're physician assistants in the Department of Orthopedics at Mount Sinai Hospital.
and we're here to help prepare you for your total joint replacement surgery.
Welcome to the Mount Sinai Hospital Total Joint Replacement class. Thank you for choosing Mount Sinai. This video is designed to help you navigate successfully from before surgery through recovery, to help you understand what to expect before, during, and after surgery, and to address any questions or concerns before coming in. We want your experience to be as pleasant as possible. What needs to be completed before surgery? You will need some preoperative testing. So make a preoperative appointment with your primary care physician. Set up the appointment, complete the preoperative medical clearance paperwork, preoperative blood work, x-rays, and chest x-ray if necessary. And please leave time for any additional testing you may require by any other physician. Infection control is very important. A nasal bacteria swab may be taken before surgery. If it is positive, a nasal ointment will be prescribed to you use 5 days before your surgery. If you do not receive a nasal swab, you may receive a one-time ointment application on the morning of your surgery. Preparing your home. Preparing your living space. Remove trip hazards, loose slippery carpets, extension cords crossing your path, and extra clutter. Do not wear any open back shoes or slippers, and have a firm armchair with armrests to sit in during your recovery. Prepare your meals. Freeze them before surgery. If you do not cook and use delivery, please update your delivery menus and your phone apps. Have commonly used items within reach. Do not use step stools after surgery. Please make sure someone can walk and feed your pets. Help with litter boxes, and most importantly, keep pets away from your incision. Our hope is for you to continue to live a healthy lifestyle through healthy eating habits. Eat nutritious foods such as fruits, vegetables, proteins, and whole grains. Exercising. Continue exercising daily and remember to stay hydrated. Daily walks. Continue or establish a walking routine. Stop or decrease nicotine intake. Mount Sinai has a sponsored Breathe Free program that can help you to stop smoking. When you schedule for your surgery, you'll receive a message from a website called Vision Tree. This site helps us check on how you're doing before surgery and again 1 year after surgery. We ask about things like your pain and how well you can move, so we can see how much progress you've made. You'll get a link to the survey by text and also by email. Please keep in mind, the email may not come from the hospital directly, so it may end up in your spam or junk folder. You can also log into your Mount Sinai MyChart portal or your Mount Sinai app. When you enter the app, just click on the menu button, scroll down under My Record, and locate and click on the Vision Tree tab. If you don't complete the surveys, someone from the orthopedic team will give you a call to help you fill them out over the phone. These surveys are very important, and many insurance companies now require them before surgery. Thank you in advance for taking the time to complete them. We truly appreciate it. Home medications and supplements. These medications must be stopped 7 days before surgery. Please discuss this with your physician before stopping any medications. Medications that must be stopped include, but are not limited to, all blood thinners. Again, please consult your doctor before stopping these medications. All NSAIDs or anti-inflammatories. All supplements, herbal and natural. Smoking, alcohol, and drugs should also be avoided at least 72 hours before your surgery, as they can interfere with your anesthesia. During your admission, your provider may convert some of your home medications to an equivalent hospital formulary medication. We will ensure that you have all your medications. Bathing with chlorhexidine gluconate. What is this? This is an antimicrobial soap. Why do I need it? You need it to help prevent infection. When should you start using it? Start using it 5 days before your surgery, as well as the day of surgery. How do you use this soap? Take your daily shower. After showering, apply 1 tablespoon of chlorhexidine on a clean washcloth. Wash the hip or knee you are having surgery on thoroughly for at least 30 seconds and rinse. Once you start using the chlorhexidine gluconate, stop using any lotions, creams, powders, or oils on your surgical leg. Avoid your face and genital area. What else do you need to know? Stop shaving and waxing your legs 7 days before surgery. No manicures and pedicures 7 days before surgery. If you develop a cold, virus, sore throat, toothache, skin infection, or any other illness during the week before your surgery, please get in touch with your surgeon's office. The surgeon will determine whether your procedure should be rescheduled. What should you bring to the hospital? Not much. Make sure your bags are packed. You may be in the hospital for one night. Please bring a list of your current medications and dosages, your cell phone charger and headphones, wear loose, comfortable clothing, supportive shoes or sneakers, eyeglasses, hearing aids, dentures, and their cases to store them, personal toiletries. If you do not choose to bring your personal toiletries, we have toiletries that we can provide for you. Please bring a government-issued photo ID, insurance card, prescription card, credit cards for co-payments for your discharge medications or your durable medical equipment. What not to bring? Please do not wear any jewelry to the hospital. All jewelry must be removed. Do not wear contact lenses. You do not need to bring laptops, iPads, or tablets, or large amounts of money. The day before your surgery, you will be contacted by your surgeon's office and informed about what time to arrive for your surgery. If you are not contacted by 3 p.m. before a weekend or a holiday, please contact your surgeon's office. You must stop eating and drinking at midnight the night before your surgery. You may sip water with necessary medications. If you are not diabetic and you are not taking diabetic injectable medications to lose weight, in the morning before your surgery, before you leave your home, please drink 16 ounces of one of the following clear liquids: water, black coffee, no milk, black tea, no milk, and Gatorade that is not red. Please avoid drinking or eating in your car on the way to the hospital. Again, you are not allowed any milk of any kind, no juices, pulp, no alcohol, or no red drinks. Please do not risk having your surgery canceled. For diabetics and those of you who are on diabetic weight loss medications listed below, please stop these medications 8 days prior to your surgery. The guidelines for eating and drinking before surgery: you can start at 8 a.m. the day before your surgery. You may eat a normal breakfast and lunch before 2 p.m. Do not eat any solid food after 2 p.m. Drink clear liquids only for the remainder of the day. Coffee with no milk, tea, no milk, water, Gatorade that is not red. Do not eat or drink anything after midnight, including clear liquids. On the day of your procedure, you may take critical medications with a small sip of water only. If you have any questions, please call your surgeon's office. When you check into the hospital, you will come to the Guggenheim Pavilion. There are 2 entrances at 100 Street, 1190 Fifth Avenue and 1468 Madison Avenue. You will go to the admitting area on the 2nd floor using the Guggenheim elevators, which can be found in the center of the atrium on the 1st floor or the MC level. Go to the 2nd floor reception desk. Sign in for your surgery, and then you will ask to be seated. Somebody will come and get you and bring you to the pre-op area, where you will change into a hospital gown, put on a hospital ID bracelet, and for your safety, you will be asked your name and date of birth multiple times throughout your hospitalization. You can also provide a phone number of your contact for after surgery so we can let them know you're out of your surgery and doing well. Once you are brought to the holding area, where you will wait for your surgery, you will meet members of your orthopedic team. They will mark your operative site. They will address any questions or concerns you may have to help provide the best care for you. You will sign consent forms. You will also meet members of the anesthesia team. They will discuss your anesthesia and address any questions and concerns you may have to help provide the best care for you. An IV will be placed in your arm. You will receive medications through your IV so that you will be comfortable throughout your procedure. If you had any bad experiences in the past with anesthesia, please inform your anesthesiologist. It is important that they have as much information as possible to provide the best anesthesia care for you. Once your surgery is complete, you'll be moved to the recovery room or the post-anesthesia care unit. You will have a bandage on your surgical site. You will have compression devices on your calves or feet to help with circulation. You will be closely monitored by our care team. You will stay in the PACU for a few hours until cleared to go home or to your room. It is important that you rest. You may be evaluated by a physical therapist while in the recovery room. They will get you out of bed and taking a few steps. You will also receive medication to help manage your pain, blood pressure, nausea. Pain management is important. Some pain is normal after surgery. You will be asked frequently about your pain. The staff will work closely with you to establish a level of comfort. It is important so that you can work with physical therapy. The hospital uses a pain scale to monitor pain management effectiveness. Pain medication will be given to you or should be taken by you if you are at home on a regular basis as needed. Remember, communication is important. So if you're staying in the hospital, please let your nurse know, or if at home, a family member know if you need pain medication. Do not wait for your pain to become unbearable before asking. Other methods to assist with pain management are ice therapy, proper positioning, rest relaxation techniques, and simple distraction by TV, music, or visitors. If you are staying overnight in the hospital, we welcome you to our orthopedic unit. You will be seen by a nurse or nursing assistant every hour throughout the day and every 1 to 2 hours overnight. We have specialized staff up on the unit, such as physician assistants, nurses, nursing assistants, physical and occupational therapists, social workers, and our front desk business associate. We will provide excellent care to ensure a smooth and positive recovery, manage your pain, make sure you're comfortable, and you will continue to receive physical and occupational therapy. This is some of the bedside equipment you will see while in the hospital. Your call bell. If you need help outside of the hourly rounding, use your call bell to ask for pain management, to use the bathroom, to get up out of bed, or for any questions about your care. The sequential compression devices that you come out of the recovery room with will be worn while in bed. They will help promote circulation and to prevent blood clots in your legs. But walking every day will also help prevent blood clots. You will receive an incentive spirometer. This helps to keep your lungs clear and prevent any atelectasis or pneumonia. You will be shown how to use this 10 times every hour. We encourage you to sit upright in a chair next to your bed daily.
This is how you use an incentive spirometer to prevent pneumonia after surgery. Wrap your lips tightly around the mouthpiece. Take slow, deep breath in, as if you were sipping liquid through straw. Do not blow into the machine. The blue indicator will only move up as you breathe in through your mouth. Keep indicator at the top for 3 seconds. Slowly breathe out through your nose. Make sure to do this 10 times every hour while you're awake.
Mobilization after surgery. It is very important to start moving immediately after surgery to promote strength and healing, prevent complications such as blood clots, atelectasis, pneumonia, constipation, and urinary retention. It will also help to decrease stiffness. It is especially important for total knee replacements to bend and straighten your knee multiple times a day. While in the hospital, please ask for assistance to get out of bed. There are plenty of staff members that can assist you to get out of bed. Physical therapists, nursing, and nursing assistants or physician assistants can all assist you. It is important that you get up and moving. Simple physical therapy goals after surgery. Getting in and out of bed and tolerating sitting out of bed. Transferring out of bed to a chair. Mobilization. Walking safely with your assistive device, going up and down stairs if needed. Knowing how to position your leg for comfort and to decrease swelling, and knowing your precautions. Occupational therapy. This therapist will instruct you on how to perform your activities of daily living. Your physical therapist will also discuss any equipment you may need for home. They will also discuss your home exercise program. You can also refer to your hip or knee PDF file that was sent to you. Nutrition after surgery. Fueling for your recovery. Fluids and fiber-rich foods can help combat constipation. Replace large portions with smaller, more frequent meals and snacks. And protein helps boost healing, energy, and your immune system. Avoid sugar, alcohol, and processed foods. Preventing blood clots. After surgery, you will be placed on a medication called an anticoagulant to help prevent blood clots. You will continue this medication for 4 weeks. It is also important for you to walk every day, wear your sequential compression devices while you are in the hospital, and wear your compression stockings daily at home. But please remove them at bedtime. Examples of anticoagulation are aspirin, Xarelto, and Eliquis. Infection prevention. After surgery, while in the hospital, you will be given antibiotics to help prevent infection. Throughout your hospital stay, the orthopedic team will evaluate your dressing and wound. If you are a diabetic, it is important that you keep your blood sugar under control for proper healing and to reduce the risk of infection. Congratulations, you're going home. Any equipment recommended by physical therapy will be ordered. The equipment will be delivered to your bedside or your home. Certain equipment may require a copayment. Each person's insurance covers different post-hospital services. Please research your insurance policy to know your available benefits. Some of your post-operative assisted devices are a rolling walker, commode, shower chair, tub bench, and a hip kit. Discharge planning begins now. Each person's insurance covers different post-hospital services. Please research your policy to know your available benefits. Our goal is for all patients to return home after surgery. Please prepare your home before surgery. Reach out to family and friends for post-operative social support. While you are in the hospital, your CAT team will closely work with you to choose a safe discharge plan. Physical therapy will determine the safest plan for discharge, which is usually home with physical therapy. They will determine your durable medical equipment as well. Social work will meet you after physical therapy to help coordinate your discharge plan and home services. Your home care service. Social worker will facilitate a referral to a home care agency. You may always request a provider of your choice. Services are determined by your insurance. Each plan is different. The home care representative will contact you to set up your evaluation at home. Someone should contact you within 24 to 48 hours of your discharge. The first visit determines the frequency of physical therapy. The subsequent visits will be with physical therapy. Outpatient physical therapy. Outpatient physical therapy generally begins after your first follow-up visit with your surgeon. You are responsible for choosing your outpatient physical therapy, and you are also responsible for making those appointments. Upon discharge, you will receive a detailed set of post-operative instructions from your orthopedic team. Post-operative prescriptions will be sent directly to your pharmacy. These prescriptions consist of a blood thinner or anticoagulant for 4 weeks, pain medication, stool softeners, an anti-inflammatory, and a medication to protect your stomach. Once you're at home, for activity and exercises, continue your physical therapy exercises, continue walking. Remember, mobilization after surgery is very important. Continue a healthy lifestyle. And keep a list of questions to ask your surgeon. For example, when can I drive? Ask these questions on your follow-up visits, and your surgeon will let you know when you are allowed to do the things that you want to do. If you have any concerns while at home, please call your surgeon's office. For emergencies, call 911.
So my name is Casey, I'm from physical therapy, and I'm going to be going over the rehab after you have your total joint replacement. The rehab team can include training by physical therapy, occupational therapy, and/or the orthopedic physician assistants. The team will see you in the recovery room 1 to 3 hours after you arrive out of the OR and as needed throughout your stay until you're discharged. Rehab in the recovery room will consist of transferring in and out of bed, walking with a rolling walker, going up and down stairs if that's necessary to go home, going over exercises lying in the bed and at the edge of the bed. And the team will discuss any equipment needs and provide equipment at bedside as necessary for discharge. So the rehab goals is to get yourself in and out of bed safely, walk safely with an assistive device, go up and down stairs if necessary, know your basic home exercises, being aware of what movements are encouraged as well as what movements, if any, should be avoided. In your binder, there are exercise handouts that you can look at and review before you have surgery. These exercises can be performed 3 times a day while in the hospital. The physical and occupational therapy will go over them with you. 2 exercises that you can do that are listed on this slide. On the left-hand side are what are called long arc quads. You can perform this exercise sitting up in a chair where you extend your surgical leg and then bend it back to the ground. And the exercise on the right are called ankle pumps, where you can lift your toes up towards the ceiling and then your heels towards the ceiling.
So my name is Jacqueline Anderson, and I'll be discussing the durable medical equipment. So for durable medical equipment, you may need a walker, cane, commode, tub transfer bench, or tools for dressing. Some of these equipment items may be covered by your insurance, Other equipment may require co-payment or full purchase. We do provide in-house vendors for some of these equipment items. Other items may be purchased from your local surgical supply store or online vendors like Amazon. For home safety at discharge, please have someone to accompany you in the home. Have a pair of loose rubber soled shoes to wear in the home. For furniture, have firm chairs with armrest. You can add pillows to low couches and chairs if necessary. Clear clutter and throw away rugs. Be mindful of pets. Be careful when walking on different surfaces. Safety in the kitchen, prepare meals ahead of time or plan for meal and grocery delivery. Organize kitchen to have items easily in reach. Safety in the bedroom, tape down or remove cords from walkways. Have clear pathways in and out of the bedroom and reorganize clothes to make them easier to reach. For safety in the bathroom, organize the shelves prior to surgery, making sure all frequently used items are easily accessible. Make sure the bathroom doorway has clear access. Your patient responsibility is to do your best when PT or OT comes to see you. Try to perform your exercises at least 3 times throughout the day once you go home. We want your surgery to be successful and the recovery process to go smooth as possible.
So after your total joint replacement surgery, the best thing you can do is to ambulate, change positions throughout the day as much as possible. The worst thing you can do is stay in one position in bed all day. It puts you at risk of a lot of complications. So taking little walks to the kitchen, to the bathroom, doing as much on your own as possible is the most important. In your discharge paperwork, you will get a set of basic exercises to do at home. You will also go over them in your joint class. I suggest that you go through them already so you're comfortable doing them at home before you even have the surgery. It's a lot easier to tap into that muscle memory to do the exercises than to learn a new exercise when you arrive in the hospital. So the first exercise is very simple. It's called a quad set. For all these exercises, the frequency is listed on the handout. It's 3 sets of 10, 3 times a day. So we're shooting for about 90 repetitions per day. Especially after a knee replacement, you might want to space those exercises more frequently. So maybe a set of 10 every hour just to keep that knee nice and loose. So the first one, you're going to work on knee extension in bed, laying flat. So you're going to press straight down into the bed, contract the quadriceps muscle, maintain that contraction for 5 seconds, and then just relax it. And that counts as 1 repetition. So we're shooting for 10 of those. Very simple exercise, just gets that knee into full extension in supine. The second exercise, now we're focusing on knee flexion. So you're going to slide your heel towards you as far as you can. There you go. Cat has beautiful range of motion. You will not have that range of motion after surgery, but we are aiming to stretch that knee. So you can extend it back down, slide it back. This might be difficult after surgery just because of pain and swelling. Still very important to push through that pain and swelling to get that new range of motion. So what you can do is you can use your hands on your thigh to help pull that leg towards you to get more of that stretch. Or an alternate method is you can, if you have a strap at home, you can use a strap. If you don't, a rolled up sheet works just fine. You can hook that sheet under your foot and just use your hands to pull that leg towards you. Perfect. All right. Perfect. The next exercise is called a straight leg raise, SLR for short. So you can bend the opposite leg just to relieve some pressure on your back. And then you want to raise your leg straight up. And again, cat has great flexibility. You can go to about the height of the knee on the other hand, and that will be great. That's a very difficult exercise to do after a knee replacement. Should be a little bit easier after a hip replacement, but still a challenge. Again, you can use that rolled up sheet to help pull it up. Perfect. The next one is a terminal knee extension. So you can have a rolled up sheet or a rolled up pillow underneath that knee, right? So you see how that knee now is in a little bit of flexion. Here, a note of caution, this position does feel great after a knee replacement. Do not leave that pillow under the knee. You want that knee nice and straight when it's in bed, and the physical therapist here will definitely stress that when they see you. But for the exercise, you're just straightening the knee. There you go. Nice and slow, and then back down. Perfect. Okay. The most basic exercise after a surgery, it helps prevent blood clots and diminish swelling. It's called ankle pumps. This you can do on both legs, just full plantar flexion, dorsiflexion. So moving your ankles up and down, nice and slow. And those you can do if you're watching TV, every commercial break. Again, the recommendation in the handout is 3 sets of 10, 3 times a day. But these I highly recommend that you do more frequently throughout the day. And you can do those laying down or sitting up. Okay, and the final one, you can sit up. Again, this exercise is predominantly for knee replacement patients, but you can do those after a hip replacement as well. We're going to work on that knee extension and flexion again. So this is for extension. Nice and slow. Try to not rely on the momentum. And again, after a knee replacement, this exercise will be very difficult to complete. And you can modify it with either a strap or a rolled up sheet, just to, again, stretch that knee, make sure that that scar tissue is not forming in a way that it restricts your range of motion. Very nice, so that's for extension. If you scoot forward, then you can focus on flexion and sliding that heel under you, forward and back as far as you can. And again, Kat has full range of motion, so this is a lot easier for her than somebody after a total joint replacement. And you can use the other leg to actually push the leg forward and back as well. It's a lot easier if you have some back support for that one, for the modification. Again, the physical therapist will go over all these exercises with you when you're here after your surgery, and if you have any questions about them still, make sure to ask either a PT or an OT.
Thank you for choosing Mount Sinai Hospital for your total joint replacement.